Assalamu alaikum. Today we will be discussing about stroke. For that we have Dr. Alim Akhtar Bhuiyan with us. He is currently working in Apollo Hospital, Dhaka, Bangladesh as a senior consultant neurologist and coordinator. He did his postgraduate residency in neurology and fellowship from United States of New York, Syracuse, USA. He obtained board certification in neurology from American Board of Psychiatry and Neurology. Earlier he worked as a senior faculty in Bangladesh Medical College, Dhaka, and consultant neurologist in Veteran Administration Hospital in Syracuse, USA, New York. So let's start with the basic. What is stroke?
Thank you, Tanbir, for the nice introduction. Today we'll be discussing regarding stroke. Stroke is basically a acute neurological disease and emergency. 100 to 150 people out of 100,000 population in any country on average have strokes. It is a disease of the central nervous system. Actually, our brain is composed of billions of cells. To be exact, more than 600 billion cells and 400 trillion synapses or connections. And this brain gets blood supply through arteries and drainage system through venous system. When this blood circulation is hampered in the arterial or venous system, we have a stroke, and this stroke can happen in the brain as well as the spinal cord. It can happen in the arterial system and also venous system. Mostly when we talk about stroke, we find strokes mostly in arterial system, and stroke is more common in the brain, and spinal cord strokes are not as common. So if sudden impairment of blood circulation in some part of the brain due to any cause can cause stroke, and depending on which part of the brain is affected, we get different kind of signs symptom.
So what is TIA or mini stroke?
TIA or mini stroke by definition is a stroke which happens and improves within 24 hours. But most of the TIAs, they last 1 to 2 hours. And this is also impairment of blood circulation in certain portion of the brain. And we can have different kind of symptom depending on what part of the brain is affected by the TIA.
So you are talking about types of stroke. So what are the types of stroke?
A stroke, we have broad classification. We can have ischemic stroke and hemorrhagic stroke. Ischemic stroke, when there is clot formation in certain portion of the arterial system or venous system, and depending on what part of the brain is affected, we can have different types of stroke. And this infarct or ischemia, initially we have ischemia, then we have infarct when the tissue is dead. It can be because of atherosclerosis in the neck or brain itself, and it causes clot formation, and it can be because of different reasons. And these are called infarct and or ischemic stroke. And there again we can have hemorrhagic stroke. Hemorrhagic stroke happens because of rupture of the blood vessels of the brain, and hemorrhagic stroke can be within the brain parenchyma. It can be outside the brain, subdural hematoma, which can happen because of head injury. We can have subarachnoid hemorrhage in the subarachnoid space. So different type of hemorrhagic stroke, and the treatment is also different and outcome is also different.
Okay, sir. So what are the signs and symptoms of stroke?
The sign symptom of stroke, as I mentioned, depends on which part of the brain is affected by the stroke. As you are aware, the brain does all the function we are doing. Some part of the brain, the occipital part, controls our vision, and the left hemisphere controls the right side of the body, right hemisphere controls the left side of the body. We have motor function like strength in our hands and lips, and we have sensory function, we have visual symptoms, we can have language symptoms. So different function, and walking is maintained by back side of the brain, the cerebropontine area. So depending on which part of the brain is affected, we have different kind of symptom. So we can have partial or complete paralysis on the other side, which is affected by the stroke. We can have sensory impairment, tingling, numbness, or paresthesia. We can have visual disturbance like loss of vision, impaired vision, or diplopia or double vision. We can have slurred speech, difficulty with talking. Sometimes we can have language dysfunction, that is, they can have problem with understanding of language, they have problem with expression of language, and patient can have sudden onset of severe headache, and it can be associated with nausea or vomiting. And patient also can have dizziness or vertigo, they can have dysarthria or slurred speech, they can have problem with balance and equilibrium. So depending on which part of the brain is affected, they will have different kind of symptoms. In TIA, the eye visual impairment can be there transiently, which is called hemorrhagic physics, and there can be other symptom depending on which part of the brain is affected.
So, can you tell us what are the risk factors of stroke?
A stroke happens because of different reasons. There are modifiable and non-modifiable risk factors. Non-modifiable risk factor means this risk factor cannot be changed, like male or female. A stroke can happen in either male or female, and it can also be because of age. Most of the stroke they happen with aging, so it can happen at any age, but most of the stroke 50-60-year-old can have stroke, and there are different reasons of stroke in different ages. Also certain ethnicity, like blacks and Hispanics, they have more strokes than Asians. So there are different ethnic group having different risk factor, and there is again modifiable risk factor. That means this risk factor can be modified or controlled to decrease the chance of having stroke. Number one is hypertension, that is high blood pressure. So if somebody has high blood pressure, that should be controlled to decrease the risk of having stroke or another repeat stroke. Then we have diabetes mellitus. Number three, we can call hypercholesteremia, high cholesterol level. Then we have smoking is one of the risk factor, and then we can have heart disease, different types of heart disease like arrhythmias like atrial fibrillation. Then we can have valvular heart disease, we can have cardiomyopathy, recent MI increase the chance. Sometimes we can have shunts, ASDs, VSDs, and coarctation of the aorta. So different heart disease. These are the important risk factor. Sedentary lifestyle, obesity. So these are the risk factor. These are the important causes. There are other rare risk factor like somebody having rheumatological disease, somebody having hypercoagulable state, certain medicine like oral contraceptive, patients taking illicit drugs and alcohol can have stroke, and patient having like amphetamine, cocaine, heroin, marijuana, this can cause a stroke. And sometimes we can have venous stroke because of abnormality. So different risk for strokes.
So if you don't mind me asking, how do you diagnose stroke?
Diagnosis of stroke is mostly straightforward, but sometimes we can face challenges because some of the other disease mimics a stroke. So Most important is taking a history. Sometimes patient, because of language problem or dysarthria, cannot express what happened. They don't remember what happened. So it is also important to take the history from the family member who has been with the patient. So proper history and neuro examination is very important to establish and think of a diagnosis of stroke. Then we check the vitals, we do the neurological examination, we do the systemic examination, and when the patient is in the hospital, we do certain basic investigation like blood test, CBC, then we do electrolytes, liver function, kidney function, we can check an ECG, we check the blood sugar, so basic blood test to see everything is okay or not. Then we also do neuroimaging study like CT scan or MRI. So CT scan is very available, readily available. It is very easy to get it, and whether patient is having hemorrhagic stroke, it is very helpful. But if somebody having an infarct or ischemia, within 24 hours CT scan does not show the changes. So if our suspicion is high, sometimes we can get the MRI to see whether the patient is having infarct. So first we have to establish whether it was ischemic stroke or hemorrhagic stroke, because the treatment is different for ischemic or hemorrhagic stroke. So imaging is a very important test. Sometimes we do the vascular study intracranially, extracranially, like MRA of the brain and neck, and then we can do CT angiogram if we are thinking of vascular anomalies like AVM aneurysm, and sometimes we do ultrasound, carotid ultrasound, to see whether there is any narrowing. And so these are the basic tests we do. But if somebody is having other reasons, uncommon reasons for stroke, we can go into that, like somebody having young patient with stroke with no conventional risk factor, we can check ANA, homocysteine level, and in children we can do other tests to see the rare causes of stroke.
Okay, sir. So in past we have seen diseases with similar sign and symptoms. So what are the diseases? What the other diseases which is similar to stroke?
So you want to mean about the differential diagnosis. That means some of the other diseases, it looks like a stroke, but this is not really a stroke. So most important, patient with hypoglycemia, low sugar, especially in diabetics, they can get confused, unconscious, and they can have paralysis or weakness on one side of the body. It looks like a stroke, but it is not a stroke. That's why when somebody comes to the emergency room, we check their blood sugar. If the blood sugar is like very low, we give them glucose and patient improves. So that is not really a stroke. It was because of hypoglycemia. So that's why hypoglycemia also can mimic a stroke. Then again we have subdural hematoma, CT scan, we show that. Sometimes brain tumor, which was asymptomatic, suddenly presents with weakness on one side or the other, and we do a CT scan, we find brain tumor, not a stroke. So this can also mimic. Sometimes seizure, like patient having seizure, they became unconscious and they cannot move one side or the other, and it is called torse paralysis. It looks like a stroke, but after few hours or days, patient gets back to normal. So these are the basic few mimickers, look-alike of a stroke.
So what should be done if somebody has a stroke?
As I discussed, a stroke is a neurological emergency. So we cannot wait. This patient should be immediately brought to the hospital, nearest hospital, which can provide good facilities. We have to understand time is brain. The more time we are losing, the worse is the outcome or prognosis. So there is a FDA approved treatment which is called RTPA. It is a clot buster. So it should be given within 4.5 hours from the symptom onset. So if patient can be brought to the hospital within 2 hours of the symptom, all the investigation and necessary test can be done, and if patient is uh, a real candidate without any contraindication, he can get RTPA. And if it is longer, he can get intraarterial thrombolysis or thrombectomy within few hours. Thrombectomy intraarterial is not available as much in our countries, but RTPA is done in some of the hospitals in Bangladesh. So patient should be immediately brought to the hospital, and if it is later, we can treat with other conventional treatment.
So what are the treatments available for stroke?
As I mentioned, most important is if it is early onset and within 24 hours, 4.5 hours, we can give the RTPA. If he or she meets the indications and has no contraindication. The studies have shown it is very helpful, and patient regains the lost neurological problem, or the neurological deficit improves within short time. But RTPA also carries 6 to 7% hemorrhagic conversion chance, and if patient is not candidate 6 hours, 8 hours within the symptom, intraarterial thrombolysis can be done, or thrombectomy in the Western world. But if it is later, then we treat these patients conventionally with antiplatelet agent like aspirin or clopidogrel or combination, and antilipid drugs. And a lot of patients, they lose function, they cannot take oral feeding, so they should be fed through NG tube. If there is arrhythmia, cardiac problem, that should be treated. If their high blood pressure is high, that should be brought down very slowly. And if patient is diabetic, that should be well controlled. And if patient has respiratory compromise, problem with breathing, so they should be taken to the ICUs. Depending on the severity of the stroke, they can be treated in the HDU or ICU. And first thing, before I just to remind you, first, once patient is in the ER, his ABC should be assessed: airway, breathing, circulation. So depending on that, patient, if very sick, has cardiorespiratory compromise, he can be treated in the ICU and later shifted to the HDU when the symptoms are stable, and then he can be shifted to the ward or cabin if he improves.
Sir, what are the outcomes from stroke?
A stroke outcome depends on the amount of stroke or damage done to the brain, and also depends on what part of the brain is affected. We have to remember, a stroke is a serious and critical disease, and 25 to 30% people, they die from stroke. Those who had massive ischemic stroke or hemorrhagic stroke or brainstem stroke, cerebellar stroke, they can die because of cardiorespiratory compromise and also the complications. These are very sick patients. Around 70% patients, they recover from stroke, and the recovery depends on the damage done. Like some strokes are lacunar stroke, mini stroke, they recover even 100%. Some stroke, maybe they recover 30%, 40%, 70%, or 20%, 10%, depending on the stroke. If it is big stroke, recovery is small. If the stroke is small, the recovery is much better. So we see patients even after 3-4 months, they can walk without help. Some patients, even after 4-5 years, they are coming in a wheelchair. Even bad stroke patient, although they survive, some of them they survive, they can have NG tube feeding, they can have catheter, they cannot swallow food, so they need lot of help even after stroke after few years. So outcome is different for different kinds of stroke.
Okay. So can you please describe what is neurorehabilitation?
Neurorehabilitation is a very important part of stroke treatment. So as I mentioned about the acute care, once patient receives the acute care, then he has a lot of disabilities. He can have motor disability, sensory disability, he can have problem with speech, he can have problem with swallowing. So this kind of disability which takes months to improve needs proper rehabilitation. Again, neurorehabilitation has different domains. So physical therapy is very important when they concentrate on motor weakness. So physiotherapy should be given regularly, and also occupational therapy for fine movement. And also, if patient cannot swallow properly, he should be assessed by a speech therapist, and then he should be seen whether he can swallow food. If he can swallow, he can be given oral feeding. And somebody after even a long time he cannot swallow food, he can have NG tube feeding. Then there is a choice whether PEG per esophageal gastrostomy tube needs to be placed if they cannot feed themselves even after a few months. So physiotherapy, occupational therapy, speech therapy, all these should be aggressive. So our idea is to rehabilitate the patient to his previous state. We cannot sometimes do that to as good as he was, but at least try to make him bring him back to his original state.
So before ending, we have one last question. So what are the preventive measures for stroke?
Thank you for this important question. As I mentioned, there are so many risk factors for stroke. There are non-modifiable risk factor. That means you cannot change your age, you cannot change your gender, ethnicity. So this cannot be modified. But modifiable risk factor is very important. Somebody having high blood pressure should have optimum control of blood pressure after a stroke. If has it should be less than 140/90 with single drug or multiple drug. If somebody having diabetes mellitus, he should have his sugar very well controlled. And then if somebody has hypercholesterolemia, that should be optimally controlled. And if somebody has heart disease or arrhythmia, that should be properly taken care of. And if somebody has obesity, then that should be weight should be well controlled. If he's smoking, he should definitely slowly give up his smoking. If somebody has sedentary lifestyle, so like sitting and doing not much, he should be exercising and doing more active, should pass a more active lifestyle. And if somebody is using drugs of abuse and alcohol, definitely he should be giving those away. So healthy lifestyle, he should take less fatty, oily food and rich food. So he should be eating a lot of healthy diet, doing exercise, be more active, and take care of the coexisting medical problems. And he should be seen by his neurologist on a regular basis, so that all these factors are well controlled. We have to remember, if somebody has a stroke, the chance of having another stroke per year is 8 to 10%. So if these are not well controlled, the chance of having another stroke is very, very high. So this is a lesson for all the patients, that they should be under regular follow-up with his neurologist.
Okay. Well, sir, thank you for your valuable time and your knowledge. We hope we'll see you soon.
Thank you very much. I think this small lecture will be very helpful for the patients and doctors. Thank you.